psychologist and I suppose the boss of the Clapham Common Clinic, of which I'm madly keen and enthusiastic. We opened in 1986, so it's almost been 30 years now we've been here in Clapham, and which is a lovely sensation. It's a really nice feeling to have been around so long. I'm still enthusiastic as I was 30 years ago about complementary health. It's just so fundamental and so good to be in. It's really nice because we see all manner of problems people have, and it's lovely to be able to resolve the problems that people have. So, for example, we might have somebody comes along with a bad back, and it's lovely they come into the clinic and they're often sort of having trouble walking up the stairs or coming in, and they go out with a jaunt in their step, which is lovely to see. And we have cases like infertility, and then eventually you see the baby being born. Well, not being born, but you see the baby. They bring the baby in to show us afterwards, which is just amazing to see. So I suppose I'm quite privileged in being in this sort of job.
I'm Amanda Rogers. I've been working here since 1993, so 21 years. I'm a kinesiologist, I'm a massage therapist, and I do facials. So kinesiology is a system of biofeedback whereby you ask the body questions through muscles. So the muscles are like your dialogue with which you're asking the body very specific questions dealing with body chemistry, body structure, body energy, and body psychology. Okay, so the muscles will react differently when you apply pressure. You apply pressure on a muscle, I'll demonstrate this later, and the muscles will change depending on what's relevant in the body. So it's a very client-friendly treatment because it involves a lot of interaction. So I'm not just doing to the client, but there's also a reciprocal response. And it's very non-invasive because I ask the muscles what they want, and I won't give them anything that they're not wanting. So kinesiology is a system of biofeedback through muscles, and we're going to use this lady's lovely quadriceps. If you just push in high pressure, that's lovely. Okay, nice strong muscle. Now, kinesiology uses homeopathic vials, and what we do is we place the vial in the hand and see how the muscle responds. And push. Okay, now the muscle's gone very weak. So we know this is to do with her large intestine. We know that there's an issue with her large intestine, but we want to know, is this a priority or is this a symptom of something else bigger that's going on?
I'm Susanna, one of the acupuncturists here at the Clapham Common Clinic. The Clapham Common Clinic is a multidisciplinary clinic. You'll find all sorts of therapies here. I'm one of the team of the acupuncturists. We have different specialties. My specialty is fertility, but I also do a lot of work on musculoskeletal problems, so pain and sports injuries and so on. So acupuncture works, well, there's different ways to look at it. From a Western scientific point of view, acupuncture works with the neurophysiology, and but it's not very well explained so far. But from an Eastern point of view, we work with the energy of the body. So the beliefs are by certain needles in some points on the meridians you will balance energy and restore health.
My name is Angel, and I've been here, I can't remember now, maybe about 15 years. I came in to cover for a friend of mine who was expecting, and I've been here ever since. I've been doing massage from a very, very early age. As a child, I was always told that I've got good hands, and I was always asked to come and massage or rub something to someone. And a friend of mine said to me one day, "Why don't you take it seriously? Because you seem to be quite good at it." And I went to college and studied, and I've been doing it ever since. But I tend to do more injuries. If someone's got something, after an injury or an operation, take away some scar tissue. I quite like working on that. And I tend to specialize as well in deep tissue, pregnant women, and I like to do kids as well. Sometimes kids can't sleep. It's always good to give them a good rub there, and then sleep, give the mothers a better night's sleep as well. I like being at this clinic because from the time I came to cover, the staff, they were really good, especially Michael. You know, got on quite well with Michael and us. And I like the fact that the clinic is very intimate. It's always, you know, you just one-on-one with you and your client, and you can actually get to know your client, and it helps for a better working environment.
Well, I'm Asun Markiegin. I am a gynecologist who has been working in England for 30 years. And as I work with women, mainly in family planning, I noticed that there was lots of sexual and relationship problems that I didn't know how to sort out just with common sense. So I decided to do the diploma in human sexuality in St. George's Hospital in London. It's a very good one, multidisciplinary one. So that's where I trained for the sex therapy. And that's what I've been doing in this clinic for, I think it's for 25, 26 years. And I do some family planning as well, and very simple gynae following pregnancies, but in a very simple way because I have no scans or things like that. And it's a lovely job actually. It's very rewarding, especially when you're having problems with, you know, maybe a woman with vaginismus that they've been married for ages and they haven't been able to conceive and they want to have a baby. That's when they tend to come. And then when they come a year later with a baby in their arms, it's like, yeah, so it worked really well. And the same thing with men, sometimes again, they may have retarded ejaculation or not coming at all. And yes, wanting a baby often is a reason for coming here. But very often it's just people who tend not to meet the right person or have always choosing the wrong man or the wrong woman. And they're just trying to work out what is in their makeup that push them into that way. And in general, people tend to get much happier lives at the end of it. Or they decide to split, because I work mainly with couples. I work with individuals as well, but I do many couples. Then it's a way of understanding more what is going on and why they're repeating patterns and why they're not fulfilling what they want to do. And just having a third person to listen to get the partner to hear what they've been saying probably for 20 years. So that's really what I do.
Hi, I'm one of the osteopaths here at the Clapham Common Clinic. I've always found it a really lovely clinic to work at, really welcoming and friendly. It's got a great location, just moments from Clapham Common Tube Station. It's been established within the local community for a long period of time. We treat a wide range of conditions here. As an osteopath, we specialise in treatment of nerve, muscle and joint problems. So whether you're looking for deep relief from stubborn muscular aches and pains, just to de-stress, or for us to address a more specific problem, we're here to help. As an osteopath, we're best known for treating lower back pain. It can be a great treatment choice for that, particularly if you've had it for a long period of time. But we're also good at treating generalised muscular aches and pains and tensions, whether they've built up through posture or sporting activities. Osteopathy is also a great treatment choice for neck pain, headaches, arthritic pain, sciatic pain and nerve pain, and also